Hi, I'm Dr. Cindy Nguyen. I'm a certified oral maxillofacial surgeon, and I also administer anesthesia here in my office. I'm here to discuss with you all the risk, benefits, and complications of surgery, in particular wisdom teeth extractions, but this can also apply to other dental extractions in the mouth. I will go over with you, based upon your particular surgery, your specific risk prior to surgery. However, I will go over with you right now all the general risks that are associated with surgeries. There are 32 teeth in the mouth, 4 of which are your wisdom teeth. Sometimes people are born without certain wisdom teeth in which they are congenitally missing. We remove wisdom teeth based upon certain criteria in which we feel that is needed to be removed, or you may be referred to me because your general dentist or orthodontist or pedodontist may deem necessary that the teeth needs to be removed. In this pamphlet here, the American Association of Oral Maxillofacial Surgeons has demonstrated complications from wisdom teeth removal and why we even remove wisdom teeth. Many times the teeth can become infected, where the tissues overlying the wisdom tooth can get food trapped underneath there, causing the gums to be inflamed or infected. Another thing that can occur is crowding. An impacted tooth can cause damage to adjacent tooth structures. Your inability to clean around this site can cause food to get dislodged in this site and a cavity can form, where your general dentist is unable to perform a filling. Cysts. Cysts can occur around teeth, as you can see here. Sometimes a cyst or a tumor can even occur, where we would remove the tooth with its associated cyst or tumor in an incisional or excisional biopsy. Based on your skeletal maturity, everyone is different in how fast they grow. But typically, between the ages of 14 to 17 is when we typically like to remove wisdom teeth. At the age of 12, the wisdom teeth have not fully matured for us to remove them. However, in 14 to 17 years old, we find that the tooth is mature enough, but not too overly mature, that the roots will go into the nerve canal, as you can see here in someone who's in their 20s. The best time to remove wisdom teeth is in between this age group because the bone is softer and its impinging upon the adjacent structures is less likely. Also, adolescents tend to heal faster than we do when we're adults. As mentioned earlier, there are 32 teeth in the mouth. Tooth numbers 1, 16, 17, and 32 are the wisdom teeth. So 4 of the 32 teeth are your wisdom teeth. Now I'm going to go over with you on this x-ray general risk of surgeries based on the anatomy that we see here. There's a nerve that travels in the bottom of the jaw. As you can see here depicted by the double line. As you can see in this x-ray, the tooth sits right in the nerve canal. This patient is at a high risk of having issues postoperatively with numbness. Numbness to the lip, chin, and tongue can occur after surgery. This numbness can last for a few days, it can last for a few weeks, it can last for a few months, or it may not even happen at all. But we have to discuss the fact that you may have numbness to your lip, chin, and tongue after surgery. Again, this patient in particular has a higher risk, and I will go over with you based on your specific x-rays whether you are at high, low risk for numbness afterwards. Looking at the top teeth, there's something here called your maxillary sinus. It's on both sides of your upper jaw. This is just simply air located here and here. The teeth naturally sit inside the sinus cavity. However, sometimes during surgery, these top wisdom teeth can get dislodged into the sinus, here, or any other landmark around there. If this is the case, we may have to do additional surgeries to retrieve the upper wisdom teeth. The other thing that can occur with upper wisdom teeth is a communication from the mouth to the sinus area. If this happens during surgery, then we use local tissue around there to close up this sinus exposure. However, after surgery, we can also do a delayed surgery repair if we notice an opening from the mouth to the sinus. Another risk with wisdom teeth surgery would be damage to adjacent structures. That's definitely something you need to be aware of if you have lots of fillings or crowns or weak teeth that are adjacent to where we're working. In the event that your crown or filling is chipped, broken, or dislodged during surgery, you will need to return to your general dentist for repair. This is a general risk that can possibly happen at any time. There are certain things to look out for after surgery. There are routine post-op issues that you will see after surgery. Bleeding. Bleeding up to 24 hours is normal. You will change out the gauze packs every 30 minutes or whenever it stops bleeding. When it stops bleeding, you do not need to change out the gauze packs anymore. Swelling. Up to 3 to 4 days is normal for post-op swelling. We ask that you put ice on your face during the first 24 hours, 15 minutes on and 15 minutes off, to help control the swelling. Now after 24 hours, you do not need to apply ice anymore. Bruising. Sometimes patients have bruising after surgery. It's unlikely, however, our elderly and females tend to have more bruising than males and our younger patients. You may not bruise at all, but be aware if you do bruise, it's something just temporary. Pain. The greatest amount of pain after surgery is generally 24 to 48 hours. You will likely be given 2 different pain medications, a narcotic as well as a non-narcotic. We will instruct you how to take this pain medicine. I also encourage you to be in front of your pain by taking it regimentally and not to wait for you to have pain. During the first 24 hours after surgery, I would advise you to take the pain medicine even if you're not having pain. Infection. You will likely be given an antibiotic to take lasting for about a week post-surgery. The antibiotic is to be given for 7 days after surgery. Please take all of your antibiotics as we prescribed. There will be stitches present. The stitches will dissolve on its own and generally last for about 5 to 7 days. We encourage you not to play with it with your tongue or pull on your cheek that can rip the stitches. Dry socket. Dry socket is the #1 post-operative complication. We ask that you do not rinse, smoke, suck, or spit. Suck like sucking on a straw, spitting really hard, or smoking. Those things can build up negative pressure in which the clot can come out. The blood clot is essential for healing. If you lose the blood clot, it is just an empty wall of bone that does not have its nutrients for you to heal. The other thing that can happen is you can get food in the socket, and that can cause a dry socket as well. Do not pull out your cheek to look at the surgical site, and don't play with the surgical site, as this can dislodge that blood clot. Please do not get dry socket. Dry socket is a very painful experience after surgery. It generally, again, occurs at day 4 or day 5 after surgery. If you do develop dry socket, this is a procedure in which we do charge you to get this area repacked. So please do not do anything that can cause you to have dry socket. Limited jaw opening is very common after removal of wisdom teeth. It can also occur with other teeth as well. After 24 hours of ice, we ask that you take a hot towel, put in your microwave for about 30 seconds, and apply it to both sides of your face while exercising your mouth open and close. This will allow yourself to open as wide as you did prior to surgery. Inability to do this will cause you to have limited opening, and this may take several weeks for it to come back. So the question remains, what can I eat? So just ask yourself every time you eat something, is this small enough that will get inside the hole? Peanuts, potato chips, popcorn, granola, seeds, anything that's small enough that will get inside the socket, and it's mainly the lower teeth, you want to refrain from eating. I encourage you to eat cold, soft foods, or even warm foods is fine, but you want it to be something that will not get inside the socket. Ice cream is good, pudding, applesauce, mashed potatoes, anything that is smooth and soft. You want to adhere to this diet for at least the first 2 weeks. Jaw fractures. Jaw fractures are rare. However, we ask that you do not engage in high impact sports after surgery, as your jaw is already weak. You do not want to cause yourself to have a jaw fracture. For the first couple weeks is what we ask that you refrain from PE or any type of high impact sports. I'm certified in administering anesthesia, and I do so here in the office with full monitoring of the patient. With anesthesia, there's general complications with anesthesia. However, it's a relatively safe thing to get done in the office. I generally make sure that the patient has not had any adverse reactions to anesthesia in the past, as well as any family history of any anesthesia complications. Everyone reacts differently from anesthesia. The anesthetic drugs that I give you are typically given IV. We give through your nose oxygen, continuous oxygen throughout the entire procedure. We have cardiac monitoring, as well as blood pressure monitoring and oxygen monitoring. Inside your IV will be medications that will help you relax, pain medications, anti-nausea medicine, steroid medications for post-operative swelling as well as nausea, and also general anesthetics. Our patients will wake up from anesthesia with no pain because the local anesthesia that I give during surgery lasts for typically about 5 to 8 hours. Please be aware that everyone reacts differently from anesthesia. You may laugh, you may sing, you may cry, or you just may sit there and just be quiet. However, let your loved ones understand that everyone's different. We recommend that at least 24 hours you are being monitored by someone at home. I hope this information's been useful for you. We will be further discussing your particular surgery on the date of surgery. Be aware that each surgery is different, each patient is different, and each tooth is different. This is just a general information given to you so that you can be well prepared for your upcoming surgery. I look forward to discussing any questions or concerns that you may have regarding your surgery.